number you have dialed is currently switched off.
Okay, good afternoon. Please let's try and join the online course early enough. The earlier we start, the better. And if you have joined, please write down your name so that I'll get to know. If you have joined this live session, please write your name. Let me know. If you joined, please write your name in the chat box. If you have joined, please say hi. Let us start. I hope you will not be like yesterday's case. Let us not be late today.
Season's greetings, Nigeria. Press 1 to copy this tune. On this day in 2014, over 700 internally arrived in Jalingo, the Taraba state capital. On this day,
Yani. So, Kufara joining man, the earlier the better now, so that we'll start by 4.
Yes, sir. Yes, sir.
Kakira Adamu.
Yes, sir.
So if you have joined, kindly say hi. If you're here, please write your name. Let me know you're here. Good afternoon or good evening, everybody.
Ainsley, we were waiting to hear from the judge.
If you have joined, please indicate by writing your name. That's the only way I will know that a reasonable number of joined, so that we'll start, because it's already 1 minute to 4. And if you have joined and you can hear me clearly, please write your name and say loud and clear. Yeah. Henry, what? Celebrate name. Celebrate name. One that. This is a reminder. Let's join on time. Yesterday we were seriously late, and you people promised me you will join on time. So if you have joined, kindly send a chat that you have joined. Let me know the person that have joined. Let's start. Yesterday there was serious delay. Okay. You all know that doing this is from my busy schedule, right? I've created this to help us protect diabetes. Okay, so you should also try and join. And if you have joined, please write down your name. Let me know the person that have joined, that will start in NS, that I will have time to do other things. So if you have joined and you can hear me, please write your name and indicate that you can hear me clear. If you have joined, kindly indicate, write down your name, let me know you have joined. So far, nobody has written his name, so I'm not aware if anyone has joined. So far, I've not seen any message. I'm still waiting. If you are part of this live session and you can hear me loud and clear, please type your name, Dr. So, because I can see that almost 10 people have viewed this slide. So, but I wouldn't know who has done that. Please write your name so that we'll start in earnest. Type your name if you are with me here. Please type your name. Is anyone here? If you have joined, kindly write your name so that I will know you have joined. Okay, we are going to start very soon. In the next 15 minutes, we are going to start. We will not wait for anyone. Today, we are going to start early. Yesterday, we waited a lot, and that took a lot of our time. So today, we are going to start early. We are going to start early. Please, if you have joined, and you can see the slide and you can hear my voice, you also let me know. So please, and if you have joined, please write in the comment section so that we can see you clearly. Okay. You're all welcome. We'll start very soon. Let's give small time for those who are yet to join to be able to join. We'll start very soon. Start very soon. Let's give small time for those who need to join to do so. Then we'll continue with our discussion. Okay, let me see the number. If we have appreciable number, we'll start now. Okay, I think we are going to start. Good evening, everybody. So, for those who were here on time yesterday, you remember that we discussed diabetic ketoacidosis. So, today we are going to be discussing the other hyperglycemic emergency, which is hyperosmolar hyperglycemic state. Okay, so from the definition, hyperosmolar hyperglycemic state is equally a hyperglycemic emergency, and it is characterized by severe hyperglycemia because individuals tend to have more high blood glucose level than people with DKA. So individuals tend to have very high blood sugar level compared to individuals with DKA. So very high blood glucose level. Apart from that, you have high osmolality, and severe dehydration. So these are the three characteristics of individuals with hyperosmolar hyperglycemic state. And this kind of emergency is commonly seen in individuals with type 2 diabetes. Okay, sorry for that. So it's commonly seen in people with type 2 diabetes, and it's either the individual have this type 2 that have this HHS at the point of diagnosis of type 2 diabetes, or there is a precipitant, because sometimes individuals do not know they are diabetic. They will likely come up with HHS, right? So that if that happens, then the patient will just come in at the point of diagnosis with just HHS, but sometimes is from precipitants, as we are going to see in the next slide. So if a diabetic patient who has type 2 DM but develop any kind of infection, for those who are here yesterday, we talked about the various infections that can trigger HHS, right? Such as UTI, chest infection, and the rest. So if an individual comes up with any infection, what infection does is that it increases insulin resistance. So once there is insulin resistance, then the insulin requirement will increase and the blood glucose will be elevated, right? So then non-adherence to dietary advice. One of the major implicators to HHS is poor dietary adherence. People that do not adhere to the dietary advice that the doctor tells them to adhere to, especially individuals that take a lot of refined sugars. If you have patient that likes taking a lot of refined sugars, right? So those ones will also come up with HHS. So that's another important precipitant for HHS. Then stroke. You know, sometimes if diabetic patients come with stroke, you'll be wondering, is it that is the stroke that caused the HHS or the HHS that caused the stroke? Because if they come into the ward, it's extremely important for every house officer and resident here that you find out if the emergency that an individual has, whether it's the stroke that caused the HHS or vice versa. How you will know that if it is the HHS that caused the stroke, you will hear the history of polyuria, polydipsia, body weakness before the stroke occur. However, if it is the stroke that caused the HHS, then there won't be that history of polyuria, polydipsia before the event of the stroke. This is very, very, very important. Very, very important, because that will give you an idea on the precipitant of the stroke, whether it is the HHS that gave the stroke or the stroke that led to HHS. Very, very important. Okay, so another one, myocardial infarction, we talked about that. Then non-adherence with medication. Most of the emergencies that we see nowadays is due to non-adherence to medication. The reason being, a lot of people now are financially handicapped, right? A lot of people are financially handicapped and they cannot adhere to the medications that are being prescribed to them. So most of the trigger that we see nowadays is due to non-adherence to medication. And the truth is that you cannot really blame the patient, right? You can't, because we are in a very, very difficult time, especially for diabetic patients, because most of their medications are now very expensive. One of the things I want you all to understand is, please do not engage in blame game. Don't be blaming these patients. You are not taking medication. Why are you not taking it? Please, right? Try and find out the challenges that they are experiencing, because some of them are actually in a very dire situation, right? So let us all try and not be judgmental. Let us try and not be judgmental, because some of them are in a very, very difficult situation in their lives. So if you try and judge them, then you are absolutely not fair to them. You are absolutely not fair to them. So please, whatsoever you do, do not be judgmental, right? Okay, so make sure you are not judgmental. Please, you should know that if you have, I'm coming. Okay. Please note that if you have not subscribed to this channel, I will not be able to be seeing your messages. So even if you send a message, I won't see. So as I said during the period while we were preparing for this course, I stated it, that is very important that if you are not subscribed, I won't be able to see your messages. So let's try and do that. Okay, so let's go on. So the next thing is the criteria, because it is very important for you to be able to differentiate HHS and DK when a patient comes in. And when a patient comes in, when you check the blood sugar, you see that the criteria for HHS, the blood glucose is greater than 33.3 millimoles per liter. But one thing is very, very important. The important thing here is, most of the patients, before they come to you, it is very possible that they have received care in other hospitals. They have received insulin. So getting that blood glucose of 33.3 is very difficult. But however, that does not rule out HHS. All right. So because most of them, when you at the point you are seeing them, the blood glucose may be 20, the blood glucose may be any particular value. So that does not mean that they do not have HHS, right? So osmolarity, okay, it is important that every doctor should know how to calculate osmolarity, right? Because if you do know how to calculate osmolarity, you will not be able to make that. So osmolarity is very, very important, that every single doctor, every one of you, should know how to calculate the osmolarity of. Okay, so I will try and make this question and answer for everyone, so that everyone can be trying to look at the setting, if I can change it. Okay. All right. Okay. So another criteria for HHS is severe dehydration. Why do they have severe dehydration? The reason why they have severe dehydration is because of the high blood sugar. You know, when blood sugar is high and the renal threshold is exceeded, the glucose will pass through the urine and water will follow. Because of the severity of the hyperglycemia, it is also linked to the severity of the dehydration. They have altered sensorium, and the altered sensorium is of course as a result of the severe dehydration and also the risk of cerebral edema, right? So they have risk of cerebral edema, so that's why they have some altered sensorium. Based on the explanation I made yesterday, the reason why there is no ketones in HHS is because they have insulin, and insulin always inhibits the process of ketone formation. Insulin does not allow ketones to be formed, unless there are cases of starvation, alcoholism, and also severe stress, but you usually see trace of ketones. But once ketones are up to 2 pluses, then it's no longer issue of HHS. That will be DKA. And lastly, there are no acidosis. Of course, there won't be acidosis since there are no ketosis, because you know that the ketones are responsible for the formation of the acidosis. Ketones are weak acids, and bicarbonate is used to buffer the ketones, leaving hydrogen ion, and that will give you metabolic acidosis. So if you are with me so far, please write we are with you so that I will see. Let me be sure I'm not the only one talking. If you're with me, please type we can hear you or we are with you, sir. Let me see it, please. Type on the comment if you are with me and you can hear me. Please type you can hear me. Let me see. Okay. If you can hear me, kindly type you can hear me loud and clear. Let me see it. Abdrazak Adamu, you can hear me, kindly type. Let me see. Is anyone here? I'm yet to see your messages. If you're here, please type. I'm waiting so that we can continue. I need to be sure that you can all hear me, those who are here. Are you all here? I cannot see your chat. I have sent a chat. Hi everyone. If you're here and you can hear me, please type you can hear me. Let me you can hear me. I cannot see your messages. Okay. Can anyone hear me? Am I loud and clear? Okay, I was told that you people are sending messages. Okay, but I have not been able to see some of them. Give me some time to work on it. Let me see how I can work on the messages that you have been sending. I have not been seeing your messages actually. Let me refresh page.